New at 10, the National Institutes of Health is studying different types of COVID-19 vaccine boosters. Dr. Anthony Fauci says it launched a clinical trial last week. It'll evaluate the safety and effectiveness of boosters available to use against future coronavirus variants. This comes as advisors to the FDA are set to meet tomorrow to discuss booster shots. Officials say the goal is to develop a general framework to inform decisions on them. Wave 31's Nicole Zedek joins us live now after speaking to local health leaders. And Nicole, you're learning more tonight about the booster shots that are readily available and if people should be concerned about becoming booster dependent.
That's right, Nicole. Now, just last week, the FDA did approve a second booster shot for anyone who's 50 years and older. So that's the fourth shot in total that age group is now eligible for. And during tomorrow's FDA meeting, we'll find out if the FDA actually recommends that fourth shot or if it's just approved as another option for these high-risk populations.
You know, the data has been back and forth about would the fourth dose would make a major difference.
How many COVID-19 shots until it stops making a difference?
The point of these booster shots is to re-challenge the immune system to get those antibody levels up to hopefully provide better protection.
Healthcare professionals say booster shots are still effective in protecting against new strains of COVID-19, like the dominant Omicron variant, BA2. But some say boosters should be more tailored towards specific variants.
Why not making it like how we do the flu vaccine once a year and make it specific for that?
Currently, the booster shots for Moderna, Pfizer, and Johnson & Johnson are the same vaccine as the initial shot. But as new mutations spread, it's likely the vaccine and boosters will have to change as well.
They look at what strains, what variants, and make that vaccine specific for these variants rather than just the older one that we have.
If the FDA continues to recommend boosters 4, 5, or even 6 months apart, can people become booster dependent? The Alabama Department of Public Health says that's unlikely.
When children receive their first vaccines, many times they're given multiple doses, over a period of several months. So this is a well-described technique in vaccine research and vaccine delivery.
Dr. Ali Hassoun with Huntsville Hospital says the FDA will likely approve that second booster shot for all of the high-risk populations, but for the rest of the population, the majority of us, he says there likely needs to be a little bit more research done into the effectiveness of that fourth shot before any recommendations are made. Reporting live in Huntsville, Nicole Zedek, Wave 31 News.
Nicole, thanks. The FDA will be live streaming the meeting tomorrow. It begins at 7:30 a.m. But if you want to find complete coronavirus coverage before then, including the pandemic's impact on your community, just download our Wave 31 News app. You can also find all of our stories online at wavetv.com.